positive to see a U.S. state go and take the step to decriminalize all drugs.
You know, if punishment worked, no one would be addicted.
While most Canadians focused on the U.S. presidential vote, it's not the only result from election night that could impact north of the border. Oregon became the first state to decriminalize hard drugs, removing criminal penalties for simple possession.
Decriminalization is a step saying, okay, these folks aren't criminals. Their issue is a health-related.
There are human psychology and social issues that lead to people to choose to do this. And so we can't just punish our way out.
Oregon's plan calls for users to be fined or to be subjected to a health assessment, a step that Canadian advocates believe remains problematic.
We want to avoid models that substitute one form of punishment for another, right? So we don't need fines. We don't need forced treatment. We don't need drug courts.
Decriminalization is just one tool being discussed in Canada, alongside increased safe drug supply and treatment alternatives. This as the death toll continues to mount.
I think the count now is 16,563 deaths in Canada in the last 4 years. It's hard to ignore. Some people do, but it's hard to ignore.
We are calling for the decriminalization of the possession of illicit drugs for personal use.
Canada's police chiefs, among others, have called on the federal government to decriminalize basic possession. But so far, there's been no movement on the issue in Parliament.
Have to convince legislators to drop their stigma, to learn about addiction and treatment and what criminalization does to people.
There's routes where the federal government can issue an exemption, for example, to a province or to multiple provinces in the country to exempt them from possession.
Ultimately, advocates say the Oregon vote offers a nearby model for our country to closely observe, and that perhaps someday it can help develop a made-in-Canada solution.
Our two main policy reform wishes and what we fight for and advocate for are those two things side by side: decriminalization and safer supply.
We want to see a system that's really focused on public health, focused on evidence, focused on human rights.
In Edmonton, Courtney Theriault, City News.